These three little letters, TMS, have been transforming lives. Joining us to share more on Charleston's first boutique TMS clinic is Dr. Suzanne Kerns, owner and chief medical officer of Inner Healing. Glad to have you with us.
Thank you for having me. I'm happy to be here.
So tell us, what does TMS stand for?
So TMS stands for transcranial magnetic stimulation. It is an FDA-approved treatment for depression and for OCD that has actually been around for a long time. It's been FDA cleared since 2008. I think it's just been very slow for people to kind of hear about it. It was slow for a little while for insurance companies to adopt it, but now it's almost universally covered for depression.
I saw that it is covered by insurance, which is shocking to me because it sounds like a lot of these modalities are sort of always outside of what the insurance carriers will cover. So I guess depending on each individual patient, you have that conversation, but how does it work exactly?
So I think about TMS a little bit like taking your brain to the gym. So our brain is not just a chemical organ, it's also an electrical organ. And we found that by using an electromagnetic field that's kind of roughly the strength of an MRI, but a lot more focused, we can place a coil over different parts of the brain and either activate or inhibit activity in the brain underneath that coil. And over time, it kind of exercises, in depression anyway, exercises that part of the brain, gets it working back in a more healthy rhythm.
Interesting. This might not be a question that you can answer because every patient is different, but typically speaking, how many of these treatments does one have to have, or is this sort of an ongoing thing, like a medication that you have to take for the rest of your life to really kind of cure the problem, the issue?
Yeah, so unfortunately in psychiatry, everything that we have is a treatment, not a cure. That said, TMS for people with treatment-resistant depression, so they've failed to respond to 2 or more medications, TMS becomes much more effective than medications at that point in time. When TMS is helpful for someone, some people are good for years, some people never need a course of TMS again, and some people start to notice signs of depression creeping back in within like a few months or a year or 2. And so for those people, we'll bring them back in, we'll treat them until they get better again, and then and go from there. So every person is an individual when it comes to planning out their TMS treatments.
I've heard of neurofeedback, biofeedback. So how are those therapies different from what you're offering at Inner Healing?
So at Inner Healing, we're offering the transcranial magnetic stimulation, which is more of a, I guess, direct treatment than neurofeedback or biofeedback, where someone's usually kind of like working with some sort of therapist and getting feedback on their particular issue. Whereas TMS is more directly treating the indication.
I see. And previous to opening up your own office, you worked at MUSC and at the VA. So you've had quite extensive experience in this field as it already is. But what you're offering at Inner Healing is quite different from what you would get in a hospital setting, for instance. So maybe you could share sort of the philosophy behind your office.
And you know, I have been fortunate enough to be exposed to these really cutting-edge evidence-based technologies for a long time, but I saw the need for applying them to the community in a warm, welcoming space. Coming in for psychiatric care is anxiety-provoking enough. And so being able to provide these services in a wraparound way, in a warm space where people can feel like they're able to share, they don't feel nervous, they feel comfortable.
And TMS is not the only thing that you offer. It sounds like you use that in conjunction with other therapies. Let's talk about a few of those, one of which is ketamine, which I think when people hear ketamine, it's a little bit controversial, but perhaps you can dispel that myth and how it's actually applied in your case.
Yeah, so ketamine's a medication that has been around for a long time. It was kind of first used as an anesthetic agent in the 70s. It's FDA approved for that indication. And then in the early 2000s, people started looking at ketamine as a treatment for depression. And so the way that it has been best studied is in a supervised medical setting.
Who is the typical client, say, in age range?
So we treat kind of late adolescents and into geriatric populations.
Great.
And I think, anyone who is struggling with depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, we're happy to see.
Wonderful. Thank you so much, Dr. Kerns, for sharing with us. Inner Healing, and it's open?
Yes, we are open.
You are open. All right, wonderful. We'll be back after this.